Today I'm talking to Professor Jeannie Haggerty from Montreal and Professor Richard Baker from Leicester. Richard, you've done some really interesting work, a systematic review looking at continuity of care and mortality.
Yes, we found 13 studies to include in the review. They were all observational, so the limitations on the level of evidence, but by and large, they tended to show an association between relationship continuity and mortality.
Tell me a little bit about what you mean by relationship continuity.
A relationship formed between a general practitioner or family doctor and a patient through a sequence of consultations. So they've got to know each other and a relationship would develop.
Is this the same issue in Canada as it is here? Do GPs work in the same way?
It's a similar way, but in fact, we have more challenges of continuity of care as defined, as we sort of looked at it very briefly defined, because unlike the UK where people register with a GP, in Canada, people have free choice of physicians. And in fact, it's still very important because patients must enroll with a GP, but it's all voluntary. And it's interesting to me that it seems that in Canada, there's more of a desire among the population to have continuity because it's not imposed. And I think that for me, for instance, the results of this study are quite compelling from a policy perspective, that within a health system, having more of either a relationship with a GP or at the very least ensuring that people see the same GP seems to have a huge mortality effect. Now, I wouldn't say huge, but we know that it's got effects in terms of making patients trust their physicians more, have better communication, be more adherent to medications. And so actually the fact that it has a mortality effect as well, I think is quite compelling from a policy perspective.
Tell me a little bit about the magnitude of this result and how this continuity of care was measured.
One was counting consultations from records of consultations, and the other was through asking patients their experience of continuity. But both methods tended to come out with this association between continuity and mortality. The size of effect, I think we would say was modest. We're left with a group of questions about for whom is continuity most beneficial, and also is it always beneficial? Are there some patients for whom it is actually harmful? And then finally, what is the mechanism behind this? Is it trust leading to greater adherence to medical and clinical advice? Or are there some other things going on that we don't really understand as yet?
Who seems to have benefited most?
We saw an effect in patients with chronic heart disease. And generally, I would say it's hard to say that patients who are sicker benefit more, but we did sort of see larger effects when they were statistically significant among patients who seem to have more morbidity. And again, I think we need to be clear that most of the studies were talking about concentrating care in a single physician. And we recognize that not all physicians are created equal.
What would you say the key message from your research is?
I would say the key message is this adds to evidence that continuity has beneficial effects. And it would be unwise to introduce policies, strategies that reduce continuity until we have evidence from randomized controlled trials. The evidence from these observational studies is what we have to work with.
You also mentioned the possibility that the continuity may have unfortunate effects also.
I think that there is a little bit of evidence that there is a kind of familiarity that stops picking up new and critical information. And that idea has been circulating, and there is some evidence to support that. For instance, delayed diagnoses of cancer that sometimes get picked up by another clinician rather than the one that most knows the patient. Whereas for me, the results of our studies say that actually overall, I think we feel pretty comfortable saying that the benefits outweigh any kind of drawbacks.
Today I've been talking to Professor Jeannie Haggerty from Montreal and Professor Richard Baker from Leicester. Thank you very much, Jeannie and Richard.